Dr. Darien, who's back to answer a question that viewers are asking.
Yes.
What is blue-green algae, and how do you know if you've been exposed?
Never heard of it.
You might see more and more headlines of this, even though you've never heard of it, because the water temperature is increasing across the United States. That allows for more bacteria and other pathogens and parasites to persist. So blue-green algae is not actually an algae at all. It's something called cyanobacteria. This is a bacteria that often has a blue-green tint to it, which is why it gets its name. And it can be associated to a neurotoxin that can include problems with your liver, problems with your brain, and also gastrointestinal symptoms if it's inhaled or ingested. So number one, making sure that you're aware of the risk, specifically before you get into standing bodies of water. And if you have any symptoms, nausea, vomiting, any tremors or muscle rigidity, or any symptoms after you get out of these bodies of water, you should seek help fast.
Immediately.
Yeah.
Your prescription for wellness?
It's getting sand out of the eye. You know, yesterday I was in the emergency room, and not necessarily sand causes, but a complication called corneal abrasions that I commonly see. So helping people get things out of their eye, I wanted to give some quick tips on how to be safe and do it properly. Number one, washing your hands. Washing your hands with soap and water is really important because you don't want to increase your risk of infection. Next, it's best to remove your contact lens. And many people don't realize this, but those foreign bodies can get trapped under the contact lens, and that can cause more injury, more harm. And one tip that you can do is fill up a clean drinking glass with clean water up to its brim and lean over and place your eye into that water and blink. That can help you get rid of that object, especially if you're having difficulty pouring water or saline into your eye. Make sure that you don't rub your eye. This can, of course, increase your risk of trauma, damage, and infection, and you don't want to be using any tools to remove anything from your eye. And then you should seek out help and medical attention if you have any changes in vision, any persistent pain, or if you just feel like there's still something there. You should come into the emergency room, urgent care, or see the eye doctor.
That is so important. I was telling Rebecca when I was a little kid, I used to, hear that if you kept the sand in your hair would fall out. She said your mom was just trying to get you to take a bath. I said, well, okay, Rebecca. Is that what mom's telling kids? They trick them.
I don't always
that.
use that as my option to get my kids to bathe, but
you got to be creative.
Yeah,
You got to be creative. All right, Doc, thank you.